Dr. Patel, let's talk about bleaching or whitening one's teeth. There seems to be three major ways of kind of doing that. One is go to the store, to the pharmacy, buy something, do it at home. One is do it in a dental office, and actually the dental office making some trays and taking it home and doing it, but very dental supervised, blah, blah, blah. And the other one is actually a very sip sap short way of like some type of laser where like within or whatever an hour or so it's all done. I wanted to talk about all three of them just a little bit, starting with the one at the store, and the pros and cons of all of them, please.
Uh, there are three different bleaching systems, as you mentioned, Helmut. The one that you buy from stores where you can just use the toothpaste, that is a bleaching toothpaste. There are strips that you attach to your teeth. Um, the biggest disadvantage of that is really patients have not seen their dentist, they don't have clean teeth, and they start using those things. They may have some gum disease, those things start causing sensitivity to the patients, and they don't realize it, and sometimes they don't even work. So some patients are very satisfied with those products. They're not inexpensive, by the way. When you buy those products over the counter, at the end of the day, by the time you have bleached teeth, they'll cost you much more than going to the dentist and just getting your trays.
Is that
Because
so?
nowadays, yes, I have actually researched that. So if you go and buy bleaching strips and you calculate the cost, I think they're $45 for those bleaching strips. And let's say you buy three sets, now you're into it for $150. You come to our office, for example, and if you're a patient of record, we offer free bleaching for life. That is amazing because yes, and that's a reward that I offer to my patients because they come in every 6 months, they get their teeth cleaned, and I need to reward them. So I give them bleaching for life. Every year I give them a free bleaching kit. However, going back to the conversation, the next type of bleaching that we offer is a home-based bleaching where we take impressions of your mouth, we manufacture bleaching trays, and then we give you material and we give you instructions on to use. The best possible results are obtained by this system. However, it requires the patient to wear it. If you are going to be non-compliant, then the third system comes into place where you come in, you sit down in the dentist chair for an hour, hour and a half. You have 4 sessions of power bleaching done under a light, and you go home and you have teeth that are 3, 4 shades lighter. Uh, Obviously, the disadvantage of doing power bleaching is sometimes you have sensitivity for a day, two, or maybe a little longer after that because you've used a very powerful bleach on your teeth. None of these
What about
bleaches are.
what about the disadvantage of money? Is it a huge money layout to do the bleaching with the power bleaching?
The 1 hour bleaching nowadays runs between $299 to $799. If you look in Beverly Hills, people are charging $799. In my area, if it's coming up to Valentine's Day, people run $299 dollar offers. As far as the tray bleaching is concerned, there are times dentists give that away for free nowadays just to welcome the patient. So all kinds of things are available for bleaching, and bleaching is not a commodity that dentists are really trying to make money out of. It is a service. It makes patients feel good about themselves, and therefore I think it should be a commodity like a toothpaste that a dentist gives you for free. And so I really believe that bleaching does make a difference in the patient's life, and there's no harm to doing bleaching, and all three products work, and it depends on your budget and your requirements.
Um, so basically, what you're saying is obviously it's the patient's choice, and the patient will take some things in consideration, such as do I want to put a tray in it every night for a few weeks or whatever it may be, months, and even longer. So if I take it over the counter, versus the one from the dentist. And of course, since you have mentioned that you're kind of giving it more or less for free, it would be very foolish in your case. But anyway, and then, or do I just want to go to a dentist, sit there an hour and have it all done? So there's those exchanges to take care of. Now, let me ask you, a patient usually needs bleaching, usually I assume, simply because he probably smokes, he drinks red wine and coffee, and that's that type of stuff. The things which will taint his teeth.
Stain.
Yeah, most likely he'll not stop doing those things just because he gets a bleaching. I mean, we're all having, I mean, I'm not so sure about you, but most of us have a little bit of a problem keeping our weight. We know that all it takes is eat less, but we're just not doing it. Or eat less of the type of foods which makes us fat, or the type of time we eat it. Whatever it is, we know how to fix it. We just can't do it. We're not willing to do so. So I'm almost sure that people who need a bleaching one day will need it again and again. Is it okay to do it, or is it like with a heart surgery where there's only so many you can do, and it's you can't do it anymore? How does that work?
It's quite all right to do bleaching as many times as you want. These bleaches are made such that they are not destructive to your enamel, and therefore it's quite safe to do it more often. And yes, you're right. If you're going to drink red wine every day and coffee every morning, you're definitely going to stain, and therefore when patients come in, for example, for Zoom bleaching, which is the kind of thing that you mentioned that is done in 1 hour, then I will always tell them that I will include the trays for you because you will need them in 3 or 4 months to rejuvenate your smile. So it's very, very important to understand that bleaching is a phenomenon that only lasts as long as you imbibe less color. You know,
Got it.
it's not permanent bleaching.
Got it. And two people actually, after they get a bleaching, a decent bleaching, whether that was with a tray from the pharmacy or from you or with the Zoom or some combination of it, after is bleaching overall something which makes people happy? Can they really see oh wow, I like to smile again? Does it make a positive effect on people?
It does make a tremendous positive effect on people. I know of several patients of mine, like I mentioned, that they bleach regularly now, and when they come in, their teeth are beautiful, and then they love smiling because their teeth are nice and white, and they look lovely. It's wonderful to see people smile with nice white teeth. So
Right.
yes, I would
So
totally agree.
So white tooth. So it's kind of, if their teeth are not damaged in any other shape and form, and if they can be bleached, one can see a good effect. It's a relatively cheap thing, right?
Yes,
Yeah.
yes, it's a relatively cheap cosmetic thing to do for yourself to get bleaching done.
One thing, you mentioned something about the people who go to the pharmacy, not to discourage them, but sometimes they have a little gum disease, so they're sensitive. I also have heard that if a person did have a filling or something in the tooth, that filling most likely will not change color. It's only the natural tooth which will change color, which some people, they go and they get bleaching, and then all of a sudden they have a very checkered type of mouth because they didn't realize they had 3-4 fillings all over the place. And now, yes, part of the tooth is white and the other tooth is like the way it is, and they really look ugly at that time and point, which is why even if they go do the over the counter, if that for some reason they think is the way to go, they should first check with their dentist to say, look,
I'm going to bleach.
I'm going to go ahead and bleach, you're fine. Or like, hey, you can bleach, but here and here and here,
this
you'll
will
have
not change, yeah.
Yeah.
Exactly. They will definitely benefit from a visit to the dentist to make sure that before they bleach, is there anything going to stand out like a sore thumb, Otherwise, they're going to go in and they'll have a very dark tooth in front, which is half white and half dark. So it's very, very important to make sure that you go check it out with the dentist before you go ahead and do anything. And
Dr. Patel,
that's about.
I like what you say. and I'm sure that people out there will increase their awareness about what's going on in all areas of dentistry and in this bleaching quite a bit with your information. Thank you very, very much, Dr. Patel.
Thanks.